Here we go. Here we go. Here the we.
Heart palpitations. This is probably one of the more common things that I see in the hospital and in the office is palpitations. So how do I, as a cardiologist, work up someone with palpitations? First, just getting a really good history and physical. What starts the palpitations? How long has this been going on for? And what are things that you have done to make it better or worse? There, they can be benign, meaning that they're not causing any problems, but some people's palpitations can be a sign of something else, such as an irregular heart rhythm that needs to be treated urgently to prevent something like a stroke. So, palpitations, what are they exactly? They're the sensations that you are having that something is going on in the heart. It can be nothing, but it can be something as atrial fibrillation, ventricular tachycardia, etc. How do we work them up? First one, other than getting the history and physical, is in the office, I'll get an EKG, an electrocardiogram, to see if we can capture it. Unfortunately, a lot of times we don't capture it if it's not happening frequently, that we may need something longer, a heart monitor. These monitors can last as little as 24 hours, but can go upwards to 30 days. We do have some longer monitors and that can go upwards to 3 years, a couple of years. It's actually surgically implanted under the skin. I reserve those ones for people who are having strokes, multiple strokes, and we haven't been able to diagnose atrial fibrillation yet. So we run a monitor and we don't find anything. We do a longer monitor. We don't find anything. You can benefit from something like a cardio mobile where you can track it yourself so that when you're getting it, you put your fingers on the device and then it shows what your rhythm looks like. What are potential triggers? Things like magnesium deficiency, potassium deficiency, stress can be a huge factor into it. Certain foods. So a lot of individuals, I will have them wear have a food diary to see if there's any potential triggers. But it can be due to ischemia or areas of the heart not getting enough blood flow. So if you have enough risk factors, sometimes we treat these palpitations by doing a stress test to make sure that you don't have any blockage that can be potentially causing it. Once again, heart palpitations are very common. They can be something as simple as PACs or PVCs, which are extra beats, but they can be also things like atrial fibrillation or even ventricular tachycardia, which is life-threatening. Most important is to follow up with your medical provider, and if they have any further questions or workup that is needed, they will refer you to a cardiologist to continue the workup and evaluation. Hope this helps.